Hi, everyone. I hope everyone can hear me and this is working. Hi, everyone. Thanks for being here with us today to reflect on World Mental Health Day 2023 and to share next steps. We have a very exciting panel here for you today, but before we get started, I'd just like to put some housekeeping out there. Please feel free to use the chat to introduce yourselves, all the participants on this webinar today. Let us know where you're coming from, where you're joining us from today, your organization, and your name. My name is Saisha. I'll be your chair for this session. I'm with the Mariwala Health Initiative based in India. We are an advocacy and grant-making organization focused on rights-based, community-led, and psychosocial approaches to mental health. Presently, we work with 41 community organizations throughout the country to make mental health services accessible to marginalized communities. On World Mental Health Day this year, which was themed Mental Health is a Universal Human Right, this sector saw and contributed to many overdue discussions on how to place mental health in a rights framework, discussions on the rights of persons with mental health issues, and saw the assertion of everyone's right to the highest attainable standard of mental health, the right to be protected from risks to mental health, and the right to access available, acceptable, and good quality mental health services. These past few years, we have seen all manner of unprecedented crises, humanitarian crises in multiple corners of the world, climate crises across the world, a pandemic. There has been immense loss of life, livelihood, disintegration of social support and communities, all of which have constituted a failure to realize many rights of groups worldwide. And the impact of such failures on mental health and well-being is so great that it will likely remain not fully knowable or fully measurable, and the global events of this past month are no exception. As we have turned the spotlight onto the relationship between mental health and human rights, it is imperative to move forward with the understanding that all human rights, including the right to good mental health, are interrelated. We cannot achieve one without achieving the other. Therefore, there is a need for all of us in mental health to work towards the realization of a full range of human rights for each and every person across the world, in order to realize our shared goal of good mental health globally. Now, rooted in the same understanding that we are all interconnected in our struggles across professional sectors and across borders, I'm looking forward to hearing reflections from our panelists today on taking their work forward in their respective contexts and building a world of good mental health for all as an undeniable, unalienable, and intersecting human right. I now request each of our panelists to introduce themselves and their work in brief. We'll start with Yevgenia, if you don't mind.
Hello, everyone. I'm Yevgenia. I'm a deputy director in a youth-led Ukrainian organization, Teenergizer. I'm very grateful for the organizers to be here on this powerful webinar. Teenergizer is, as I said, youth-led Ukrainian organization, and our model is focusing on empowerment of young people to protect their health and exercise their human rights. We are now focusing on psychosocial support for adolescents and young people by maintaining a system of youth-friendly peer-to-peer online counseling and providing peer trainings on mental and sexual health to adolescents and youth from all around Ukraine. Nice to meet you all.
Thank you, Yevgenia. Harun, if you wouldn't mind going next.
Yeah, thank you. My name is Harun, and I'm working with ADD International in Bangladesh chapter, and I'm working as a mental health lead of community-based mental health program in Bangladesh. And as you know, that's ADD is an international organization registered in UK, and ADD works in solidarity with disability rights movements, supporting them to thrive. And it works with organizations led by people with lived experience of disability. And we center that lived experience in everything we do. And we believe that there is no justice without disability justice. So as you know, that's mental health disability is a part of our Disability Rights Act in Bangladesh. Therefore, we are also working on mental health and psychosocial disabilities for long time in Bangladesh, especially in the marginalized communities. the grassroots levels where services are not available and hard to reach areas, especially disaster and climate prone areas for children and young people. Our organization support disability rights and activists with funding and leadership skills to build powerful movements for change. Nice to meet you, everyone. Thank you.
Thank you, Harun. Moitri, if I can ask you to go next, please.
Sure. Hi, everyone. I'm Moitri. I'm the CEO and founder of Cities Rise. Cities Rise is a global platform for local collective action for young people's mental health and well-being. And the idea here is that how do you get different stakeholders to collaborate with each other, both at the local as well as the global level. So how to bring youth, researchers, policymakers, social entrepreneurs, collaborate across different cities across the world. Originally, this was launched in India, Kenya, Colombia, and the United States. But at this point, we are working globally, and there are three main.
Is Moitri frozen for anyone else? Okay, right. Maybe we wait for her connection to come back and move on to Peter. Are you there with us?
Yes, good morning from Ghana. My name is Peter Yaru. I am the Executive Director of Basic Needs Ghana. We are a mental health and development advocacy organization. We are part of a community of practice of the model for mental health and development across 12 countries in the world. Its origins have been with the Basic Needs Trust in the UK, but these are all now in-country, nationally led and registered organizations. And we work to ensure people with lived experience of mental illness satisfy their basic needs and exercise their basic rights. And also to make mental health more of a development issue, a human rights centered issue than just a medical or health phenomenon to research into brain or mind and how people function. So emphasizing the point that the mental health of everybody is very much a public health as well as development issue. And so we have been working very closely with several organizations, United for Global Mental Health Inclusive, that has been a very strong partner, both technically and financially. And we have collaborated in the last few years in a number of areas, particularly the recent World Mental Health Day or week, because it ran close to a month. It's still going on with a financial support. So thank you to be with such a distinguished panelist. Some of them I've met in person. Okay, thank you.
Thank you, Peter. Moitri, we lost you for a minute if you want to complete your introduction now.
Apologies about that. I'm not sure where I got disconnected, but maybe just wrapping up towards the end. I was saying that we originally started the work in 4 countries, India, Kenya, Colombia, and the United States. And at this point, we work globally, essentially along 3 main pillars of work. One is around research and science and looking at where new innovations need to happen, especially at this intersection of different collaborations happening together. And the second one is more accelerated learning platform to see how we can support the uptake of innovations. And the third is more the movement part, which is with cities and youth. Thank you very much.
Thank you, Moitri. James, if you could round off the introductions.
Hi, everyone. I'm James. I'm the Director of Policy, Advocacy and Financing at United for Global Mental Health. We're an advocacy organisation, and in a nutshell, we are advocating and campaigning for greater financial and political investment in mental health across the world that would lead to everybody being able to access the mental health support that they need. And part of what we do is to facilitate the Global Mental Health Action Network Secretariat. So a lot of the people you'll be engaging with in the running of the Action Network will be part of the United team as well. And it's a pleasure to be here today. Thank you so much.
All right, thank you everyone. And before we go in and hear from each of our panelists more in depth about their activities around World Mental Health Day this year and their other work, I request all participants here to use the Q&A function to pose your question to the panelists, and to use the chat function at liberty to share about your own activities and events surrounding World Mental Health Day and your work in general. We will come back to these questions in the session after all panelists have spoken. Ivenia, I'd like to start with you, if that's all right, and pose this question to you. This year's theme for World Mental Health Day was mental health is a universal human right. So what can we do to ensure mental health services are in line with human rights laws? You could speak to that, please.
Thank you for your question. Actually, it looks like very simple, but it doesn't have a simple answer. From the perspective of Ukraine, here the discussion about mental health on the national level started not long ago. It started actually previous year after the full-scale invasion of Ukraine. And after the start of so widely involved national discussion, we saw the three most weak sides that now like barriers to make mental health just regular human right. These three most weak sides now in Ukraine are that we still working on making a united mental health services system where all the professionals knows where to refer the client in case of any special needs. For now, it's still separated, and not all the when the client, for example, wants to receive psychological or psychiatric support, client does not know each time where to refer, and sometimes even specialists, they do not know to whom to refer if there is some special needs of the client. Second is still existing stigma about mental health within Ukrainian society, because unfortunately, as now we conducted, I will put a little bit info about this, because we conducted a joint survey with another organization, YouReport, and this survey was about how Ukrainian youth is feeling right now, dedicated to the Mental Health Day. And we received more than 3,000 answers, and from 3,000 respondents from 14 years to 33 years. And unfortunately, around, if I'm not mistaken, it was 55% of the 3,000 respondents, they indicated that they have never requested mental health support when they were in a depressive state. And of course, stigma that mental health is something that is not extra, something that is not of same importance as physical health, it influences why Ukrainian youth do not request help when they need it, actually. And the third barrier that we are dealing now is absence of a united institution that will certify the specialists from mental health services. So we, Ukrainian society, are aware that all the specialists from mental health services, they received proper education and they went through proper certification, and they will provide proper help. Unfortunately, these gaps create a lot of specialists who are not all the time getting all the knowledge about ethics, about actually psychology and psychiatry, if we speak about doctors. and therefore it influences the still existing stigma, because some of Ukrainian youth and not only youth, all who tried to get help from mental health services, they can get not proper support, and therefore will be like, okay, that's not what I need, and it's not very professional and so on. Therefore, these three main weak sides, they needed to be dealt, and some of them, like the first key point is of course psychoeducation, that our organization and lots of other NGOs are working right now in Ukraine, and hopefully now with the support of the government we can provide it on the national level, so youth and all other people, they are aware of what is mental health actually and what they should receive as a mental health support. Thank you.
Thank you, Evgenia, for sharing these efforts that your organization has undertaken. I'm particularly hopeful when I see youth-led initiatives for youth, and of course, knowing that when you begin with a specific group, there are benefits to many others, and it's interesting to also hear how the mental health movement in Ukraine has grown in the time since the invasion, and how crisis and mental health is so interrelated, as I'm sure we all know. So thank you for speaking on that. I'd like to move next to Moitri, if that's all right, and understand from you how Cities Rise commemorated World Mental Health Day, and what you can tell us about the recently launched call to action for the Centered Cities movement.
Thank you, Sasha. So we had the opportunity to celebrate World Mental Health Day both at locally in different cities, as well as the global call to action. So sharing a couple of glimpses from the kind of celebration that was happening locally. So in Chennai, the Youth Leaders Networks, they invited all their families together, so around 3 generations, and they explored campaigns and looked at key messages. So they worked in smaller groups and came up with messages like hope as an antidote to fear, or on kindness, be kind to yourself because you matter. And then they kind of did a whole graffiti workshop to collectively create a unified message, which was along the lines of mental health as universal human rights. And after that, they did a number of different exercises, more play-based, like card-based games, but that led to different contemplative practices around how to take care of our hearts, our minds, take care of each other. So this is sort of part of the ongoing activities that the Youth Leaders Network have been doing in the cities, but it's a way to kind of activate more intergenerational dialogue and more new ways of talking about mental health. So that was a little bit of Chennai. In Kenya, in Nairobi, the Ministry of Health, the county government, and local partners and Cities Rise, they all got together, and specifically where the teams they worked on was inviting young people, and they created a youth village. And in the youth village, they showcased all the different, especially youth-led innovations that's been happening in Nairobi that foster resilience and also more intergenerational dialogue between government and youth. And this was also followed by a lot of creative arts-based activities like Letter to Your Future Self and other different ways of engaging. And also then there was a lot of conversations, again, very intergenerational conversations with the government on creating a national effort to implement the Nairobi Mental Health Action Plan, specifically more around how to integrate mental health as in primary healthcare, along the lines, again, of mental health being a universal human right. I think globally we had the opportunity to launch the call to action to centered cities. This happened as part of the Wellbeing Forum in London. And this was essentially a call to action for different cities to join the Centered Cities movement. Essentially, this is the creation of a unifying framework for global action based on all of the work in the last 6 years that we've been doing in different cities across low, middle, high income countries. and what some of these insights, very bottom up, very grassroots, that has emerged along with some of the global learnings. And essentially, this is being focused now on how to drive rapid action in 4 key areas, what we call the inner social environmental dimensions of a young person's life journey, as well as the underlying systems changes that impact mental health and well-being. And we're very excited that we're going to be recruiting beyond the first 5 cities, 20 cities to become more of pathfinder cities, and look at how to start enacting these more transformative paradigm shifts. And the key domains that are being discussed right now are education, arts and culture, nature and environment, youth mobilization, city planning and policy, and a few others. So would love to find a way where, if there are places y'all are working in or other partners, how we can collectively come together to bring, all of our diverse perspectives towards accelerating this work in different communities and cities. So thank you very much, Session.
Thank you, Maitri. Would love to hear more, perhaps in the audience interaction as well. It's really, again, inspiring to see and feel hopeful when you hear of cross-cutting mental health work that looks into youth participation and matters such as city planning, and really looking at how people who are most affected are able to push for the changes that they need themselves and have that participatory approach. So thank you for that. I'd like to hand over to Harun now and understand from you what World Mental Health Day celebrations look like in Bangladesh, and how do you plan on building the momentum from it?
Thank you, Saisha, and all panelists, as well as the participants. Greetings from WMHD International Bangladesh, and yeah, this is a very important question that you're asking about World Mental Health Day. So I would like to highlight some what we actually did to celebrate World Mental Health Day. As you know, mental health is a neglected and stigmatized topic, despite the high prevalence of mental health conditions among the population in Bangladesh, especially children and young people. The celebration of World Mental Health Day this year was an opportunity to highlight the importance of mental health care in Bangladesh, and to showcase the initiatives and achievements of various organizations. With the theme, mental health is a universal human rights, the World Mental Health Day celebrated widely in Bangladesh this year, with different programs, both in national and local levels, by different organizations, including the government, WHO, NGOs, universities, different organizations of professionals, media, and private service providers. I mean, the health service providers. The activities includes the rally, mass gathering, and human chain discussion, workshops, mental health knowledge fairs, art exhibitions, cultural programs, and many more. So I have seen a lot of enthusiasm among people to celebrate this year World Mental Health Day. First, there has been a huge increase in the participation of people, especially young people, in the programs to celebrate this day. Second, what I think is most important is that this year there has been an increase in the participation of people at the local level, especially in marginalized communities where we are working. And again, as awareness among them has increased, so has service-seeking behavior also changed this year, we found. Thirdly, at the national level, government is more positive and shows positive attitude towards the implementation of the mental health policy and strategic plan. So I saw that this year there's a huge increase of the participation of mass people, including the lived experiences at the community level. That's the important thing, that's participation and increasing participation and celebration by different organizations at the grassroots level, including organization of persons with disabilities, has increased actually tremendously. So I would like to say that this will create the enabling situation of strengthening the mental health support system at the community level. As you know that we have different problems on implementing the policy and the act. And we want to keep this momentum and move forward through different ways. And we have some plan to move forward for the next year or from now with the government. As you know, we have the National Mental Health Policy that's the government endorsed, and we have National Mental Health Strategic Plan 2020 and 2020 to 30 that's approved for implementation. And important thing is that's a new development under the 5th Health, Population and Nutrition Sector Program. The government developed separate operational plan, that's SOP, for mental health, substance use disorders and disabilities. And we hopeful that with this celebration on World Mental Health Day, we can move forward with the government to implement, that's the main crisis, the implementation of the policies and acts in future, as well as increasing the budget. You know, there is only 0.5% of the total health budget that's implementing budget for mental health. So we hopefully that we can move forward with this enthusiasm of this year to implement our policies and reform our policies, as well as the strengthening our mental health support system as committed by the government to implement or to bring forward the mental health in the primary healthcare system. Thank you.
Thank you. Thank you, Harun, for sharing those important steps and milestones from Bangladesh. I think it's hopeful that the implementation does come through, and with the work and force of many different organizations, like you have mentioned, prove the results that we're hoping for. I think it's also really important what the points you mentioned about looking across different groups and different organizations and bringing everyone into the fold of mental health as well. I think understanding mental health within disability rights frameworks is sometimes one that is lost in conversation. So I thank you for bringing attention to that as well. I'd like to now move on to Peter, if you're with us. Hi.
Hi.
And ask you, how did Basic Needs Ghana commemorate World Mental Health Day, and how do you look at mental health as a priority in Ghana in 2024?
Thank you very much. I must say, thanks to the support of United for Global Mental Health, Basic Needs was able to implement its planned activities. Based on the theme, which was very appropriate, we tried to raise awareness around the issue of mental health, bringing service user to the center in all of this, for them to speak from their lived experience and to engage, do targeted engagements that could elicit both support and pronouncements by government and state duty bearers as to what can be done to improve mental health, including investments in the area of mental health. So in the area of awareness raising, we did community-based engagements, what we call DEBES, that bring together traditional authorities and people of various walks of life, to a point where discussions and experiences around what mental health has been to some people were articulated. and got wider coverage. We maximized the media as usual, having recognized that the media is a powerful tool in propagating information and educating the general public. We maximized community FM radio stations, where a number of people with lived experience served as panelists to discuss their own experiences and how certain infringements upon them affected their human rights, as well as good practices by relatives, friends, and families, and even health facilities that made them feel that their rights were protected and guaranteed. And that got wide coverage, both locally and national level. We also targeted the reading public with a feature article focusing on mental health as a human right and what basic needs has done over the years to actualize the theme, right from promoting awareness, information, and sensitization, to facilitating treatment services, to enhancing skills and capacities of people to live positively, and healthcare workers to provide more practices, just similar to what Abdullah was saying about behavior and practice improvement, more positive attitudes, and continuing to support advocacy for inclusive policies, particularly around the social protection schemes that initially did not really factor in people with lived experience or people living with mental illness. Just focus more around persons with physical disability, but through our efforts, got revisions of the Disability Common Fund, the National Health Insurance Scheme, to now be accepting of people who have mental health conditions. And it's still ongoing, even though the month ends today. We are still doing that. But as already articulated elsewhere by previous panelists, we would say that there is quite a steady increase in awareness and more positive attitudes to mental health issues. And an example I can give was those days, anybody who was a reporter or a media correspondent or journalist who asked you, oh, how big is the mental health issue? What is the burden of mental illness? Can people with mental illness be able to return to work and be significant contributors, ideally not violent, to now being issue-based around what do you think about universal health coverage? And is the government doing enough to ensure that the universal health coverage strategy of the country includes addressing mental health issues? How about the budget for mental health? And how can local government be more involved? What do you want private sector to do to address mental health issues? And what is the place of young people and women and people in the rural areas? How can they be active participants? And I thought that was quite a significant change from can people with mental illness be able to get well and even do work for themselves or go back to school, to saying how can this be supported? And I think that is one indicator of the change that we are seeing. The other is the assurance from traditional authority that if anybody abuses or assaults physically or does anything verbally, emotionally, and it comes to their attention, they would exact punishment, including which may not be a proper corporal punishment on people seen to pass derogatory remarks. And one traditional authority was very emphatic about taking sexual advantage of people living with mental illness if it is reported that because of the vulnerability of a person with mental illness, particularly females, somebody takes advantage of them sexually, and refuses to own up or is noticed, quite a good amount of traditional and cultural-based sanctions will be exacted on such people as a deterrent. So that gives an assurance of their protection in the communities, and that there is a place they can report, not necessarily at the legal level, but even at the traditional cultural level, where they would get support for this. So this is quite improving in terms of how far we have come. Unfortunately, I would say, yes, the assurances of investments in mental health, oh yes, we will do something about it, is yet to be seen. And we are hoping that by the time the next budget of the government comes, we would watch closely whether there's been any significant budgetary allocation within the health budget for mental health, particularly at the community level. So even though I'm ending on a not too exciting note, I would say overall, there is a sea of change, and it is encouraging. We just need to keep hammering on it. If we let our guard down, the gains made so far may not really progress. Thank you, and over for now.
Thank you so much, Peter. And just like you said, the work doesn't stop at the end of October. Thank you so much for sharing those milestones with us. Over to you, James. Wanted to I understand that United for Global Mental Health has just released a new mental health financing report. So what are some of the key takeaways from this report, and how can advocates use this resource?
Thanks very much. So, the theme of World Mental Health Day this year was obviously rights, which we've been talking about. And, when I was much younger, I was always thinking that rights were about words and about deeds, and we do following those words. And the more I spent time in the health sector, the more I've understood that words are not all that we need to make sure we uphold people's human rights. And a part of upholding people's human rights is about how we implement those commitments, and a lot of that's to do with finance. And so we can have excellent mental health policies and legislation across the world, but if those are not financed properly to an adequate level, we can't implement and live up to the rights commitments within those. And so we looked at this at United for Global Mental Health this year. We wanted to look at what's the current situation of financing for mental health across the world. There's 3 key stats I'm going to talk about over the next couple of minutes, and I'll highlight those for you to think about beyond this meeting, and hopefully look at the report as well. So we looked at the levels of financing across the world using the WHO Mental Health Atlas data. I think a lot of people will be familiar with that work, and that's where the WHO invites countries to report on lots of different indicators of mental health services. And one of those is from their national health accounts, but how much money they're spending on mental health. So we looked at that, we took that data, and we compared it against targets that was set in 2018. Now, these are targets set by the Lancet Commission for Mental Health and Sustainable Development about what should governments be spending on mental health. Now, these are from an independent commission, and therefore they're not agreed by governments, and so then we can't hold governments accountable to those. But it is interesting to see what are the experts saying about what we should be spending and what governments are spending. So those targets were that low and middle-income countries should be allocating 5% of their health budgets to mental health, and that high-income countries should be allocating 10% of their health budgets to mental health. So taking those 2 sets of data, the targets and then what governments are reporting, we could see how many governments were living up to those recommendations. We saw that out of the 85 countries that reported to WHO their mental health spending, only 9 of those countries were exceeding the targets, or living up to or exceeding those targets, leaving the vast majority of governments not meeting those targets. And actually, the average percentage that governments were below the targets was 3.7%. That's a median average. So we're quite a long way, especially when we're saying that for the majority of governments, it's a 5% target. For the global average to be 3.7 percentage points away from that target shows you just how far away we are. What does that mean in terms of dollars and cents? So adding all of this up and looking at what the gap is, we can see that there's a $200 billion annual gap in financing for mental health across the world. Now, a lot of this is in high-income countries because the expectation of their spending is much higher and their health budgets are much higher, so the percentages are slightly skewed there. But it's still significant across the world. $200 billion is a lot of money. And when we're talking about the levels of finance that we see governments putting into mental health and that international donors are putting into mental health, we see just how far away we are from filling that gap. And in fact, over the last few years, we've seen a decrease in donor finance into mental health, with a peak in 2018, 2019 of $300 million per year coming from official development assistance. So that's governments who are donor governments, their expenditure in mental health dropping to $200 million in 2020 and 2021. Now, that's the last years of data we had, and hopefully we'll see a recovery from that when the more recent years of data are published. And my assumption would be that some of that is due to shifting money away from other areas of the health sector to the COVID response, and a general squeezing of donor aid budgets across the world that we're seeing across all of activities. However, it is concerning that there was a decrease, and we need to continue to push donors to be increasing the finance that they are putting into mental health to live up to the commitments of rights to the highest attainable standard of mental health, which all governments have committed to. And we know that finance and donor finance, as well as domestic spending, is incredibly important to achieving this. So what are some of the solutions? Well, one of the solutions, and this is the third statistic, is that if donor governments have that official development assistance, which is currently a very small part of what donors are spending on health aid or health development assistance, so across all of the health portfolios and spectrums, it's currently just below 0.5% is allocated to mental health of all of health aid spending. If that was increased to 0.5%, but then increased to 1%, so that all government donors or official development assistance spent on health, out of all of it, 1% was spent on mental health, we would see an extra $500 million per year allocated to mental health. Now that's a long way from filling the $200 billion a year financing gap for mental health. But actually, if it's targeted in specific places, that can make a huge difference in sort of its catalytic effect in generating more finance and more sustainable finance for mental health. So this year, United for Global Mental Health looked at how are we financing what needs to be financed and the services within countries and across the world that need to be done to realize people's rights. And there were three key statistics that we found from that research. One is that the global median average of governments below the recommended targets for their allocation of mental health within health budgets was 3.7%. This meant that annually we were looking at over $200 billion in a financing gap for mental health. And that if donors were to increase the allocation of mental health from just under 0.5 to 1% of their spending on health, we would see an extra $500 million per year spent in low and lower middle income countries.
Thank you, James.
That's my summary of the report.
Thank you for that summary. I'm sure there's lots more to discover and interpret and use in our advocacy within the larger report, but it just goes to show how far we've come and how much further we have to go to realize our goals of good global mental health for all, and financing definitely underscores almost everything that does happen in the sector. So thank you for sharing that. and like to move on now to the audience Q&A. And first, we have one for Moitri, which someone's asking, how do other organizations get to replicate the centered cities concepts in different countries? I think the participant's asking, how can different organizations get involved with the centered cities movement?
Yeah, thank you, Sasha. I think there are a couple of ways to do it. One is from a domain perspective. So depending on which area that your organization is passionate about, or where do you feel you want to kind of mobilize greater action, whether that's in education, arts, culture, nature, environment, or even intersections of some of these, I think that would be a way to engage, because what we are looking at is taking a domain lens in terms of thinking about how to mobilize demand supply. So we would be able to network you if, depending on whichever domain you want to bring greater action to, some of the best other entrepreneurs, as well as different cities and communities. So one way is through the domain lens, the other is more from a geographical lens. So depending on where you're working, if you feel that there is local leadership to do more this type of local collective action, so how to activate maybe different cities or communities in the areas that you're working in, and if you would yourself like to be part of that collective action, then we would partner with you to kind of see how to bring the different aspects of whether it's youth engagement or partnership with government, depending on where your natural strengths are, and where to then build your capacity to play this type of work. Thank you so much.
Thanks, Moitri. We have a few more questions in here. First, someone is asking, how has this year's World Mental Health Day differed to previous years? I think I'd like to invite anyone to respond to that if they'd like to. But perhaps we can start with Harun, if you have any thoughts on this question.
Yeah, thank you for the question. I think that one important thing is the theme. That's this year theme. Mental health is a universal health rights, universal human rights. So this is, I think, this support us to move forward, to think as mental health as a human rights in all aspects. So this is one thing, and then other thing is that as repeated advocacy and awareness program in our country and including other LMICs, I think there's the important thing is that as a result of advocacy and awareness program at the grassroots level, so there's a demand side of service seeking is increased a lot. So this is important. That's this year we came to bring forward our achievements for the future. And another thing is that's for us that we have the problem is that we already mentioned that's regarding the financial support, both for the government and also for the private organizations like us. We are that's working on mental health issues. As you know that there are huge gaps in service seeking behaviors, as well as the service gaps. That's in Bangladesh is 92% and 92% for adult and 92% for children and other people. So this year there's a hope creates through this theme, and as well as the increasing awareness on and also pressure to the government, and also that's a political commitment that's committed by the governments in the and in building in the universal health coverage. So that's why this year that's bring the importance, and that's we celebrating this year differently and with participation of different people. That's my thinking.
Thanks. Thank you, Harun. Evgenia, I think I see your hand up. Please go ahead.
Yeah. Yeah, I just wanted to add that actually in Ukraine we had quite rapid changes within the mental health policy with these 2 years. Like previous year, the focus was on the military, mental health of the military due to the request from the society. But for this year, I see that now discussions are going about mental health among civilians and among young people, adolescents. And I know that now we have a lot of new reforms within the educational system and the health system to include mental health specialists in all these systems, because previously they were not involved. And I think it's quite a good outcome of all our work of the NGOs and government and all the donors who help us. Yeah, thank you.
Thank you, Evgenia. Does anybody else want to add anything?
Yeah, if I may add a bit, what was different was the narrative, because for each World Mental Health Day, you try to articulate what the theme is, and sometimes the narratives are not exactly the same, even though each of the themes over the years we have been part of boil down to raising awareness and consciousness around human rights, reducing stigma, improving inclusion and participation, investments, and the rest. But the theme usually gives you that guidance to emphasize more on the aspects that it is raising. And I would say that is what was a bit different. Apart from that, I would say it has been more of the same, reaching duty bearers, both state, traditional and cultural, sometimes religious, increasingly, and well, what is also different, I could say, is increasingly becoming people with lived experience led than just practitioners, and getting more and more of them who are willing to say, yes, I'm ready to speak about my experience, if that would help inform and educate and communicate what we want to do. And also taking advantage of other opportunities. I think over the years, the social media has become a game changer too, and trying to create awareness, engage in advocacy through social media has also been something that is recognized and used increasingly. So this is what I could say from what we did in Ghana. Thank you, and over.
Thank you, Peter. I think in the interest of time, we will need to close the Q&A for now, but we'll request everyone who has an unanswered question to please continue the conversation on Circle and see if you can connect with the panelists post this webinar as well. Would like to ask all panelists to round us off with some key takeaways from today, and complete this sentence in a tweet length answer, rapid fire, across all participants. And the statement for you to fill in the blanks for is: to build on the momentum from World Mental Health Day, we must ... So I'd like to invite anyone to get started, if you have an answer in your mind already to this tweet length question.
I'll give it a go, just to kick us off. Maybe I'm going to slightly change it. So I'm going to say, to build on momentum from World Mental Health Day, those in power must back up their good words with good deeds. And to do this, we must be investing in mental health.
Thank you, James.
Just it.
Great. I love the reframing. Moitri, would you like to go next, or Evgenia, or anybody who's ready?
Yeah, I'm ready.
Okay.
So I think based on all the discussions, I think that to build on the momentum of Mental Health Day, we must also ensure high quality psychoeducation takes place in all our activities.
Thank you, Venya. Peter, would you like to go next?
I think to bring the momentum, we must build more bridges and collaborations across various interest groups, including traditional donors, government, but also private sector, and bring in persons with lived experience to lead the process. It's more than a tweet, but
No, it's great.
thank you.
Arun?
Yeah, I can say build on the momentum from this year World Mental Health Day. We must act, we must talk more, we must discuss. This is not the issue of only one day. We must act in every day. Thank you.
Thank you, Arun. And last but not least, Maitri.
Sure. I think there's a pattern here. I think I was going to say that to build on the momentum from World Mental Health Day, we must urgently collaborate across generations, cultures, and sectors. Thank you.
Absolutely. I second that entirely. Thank you so much. Everyone, thank you to all our panelists and all our participants for being here today and having this conversation with us. The next in this webinar series will be on digital mental health. The registration link, I'm told, is in the chat. You can find it. And as I said before, there's many, many more conversations to be had from what we've discussed today. So please stay in touch. I think there's a circle link also being shared, so you can get back into the conversation through that link and discuss and check out everyone's work. I think there were different links said through the webinar chat as well of everyone's work here. So to check that out and explore that more in depth. Thank you all very, very much for being here. And I think we are just in time. Is that good, Divya?
Thank you, everybody.
Thank you, Sasha.
Bye-bye.
Thank you very much.
you.
Bye-bye.